through a bunch of examples of ways in which we're using health AI in healthcare, and I'm using it in my day to day. And then and then after we got kind of go through the provider side use of AI, that's when I kind of want to switch to talk about patients and how um, patients are using it to understand their health. And again, would love to hear from you all. And then I think it's worth spending a little bit of time if we have at the end to talk about like risks and how we're addressing them, how to mitigate the risks. Obviously, a lot of people have concerns despite how exciting AI is. And I think it's really important to acknowledge those concerns and just think about how they weigh against the pros and the cons. Hold on one second.
Think he's ordering his dinner.
Hey, sorry. I'm solo parenting tonight. My wife's out of town, so
Oh.
my daughter's having a little bit of trouble going to sleep. But okay, all right. Um, okay, so I think of this as like the little bit of a crisis in healthcare that's been going on for the past 10, 15, 20 years. And that's the problem that I think is worth addressing. So administratively, I mean, there are loads of statistics on how much time we as healthcare providers spend on menial tasks. And I've just written some down here, but there are studies showing that for every 1 hour of direct patient care time, healthcare providers spend nearly 2 additional hours on electronic health record and desk work. Again, for every hour of patient care, an additional 2 hours of paperwork, basically, and clicking on the electronic health record. Um, there's studies showing that physicians spend about 20%, 27% of their office day on direct sort of like FaceTime with patients, and about 50% of their office day is spent on EHR and desk work. Um, there's this thing called pajama time, which we talk about in healthcare, which is when you're home and done for the day at work, physicians are spending 1 to 2 hours per night on average on electronic health record tasks, writing notes, finishing visits, things like that at home outside of work. Um, During a visit, I'm sure everyone in here has experienced this, but a lot of healthcare providers spend a third or half of the visit interfacing more with the computer than they do with the person in front of them. So, and this has created a lot of issues. It's created issues with trust. It's created issues with patient-provider relationships. It's created issues with burnout in our field. So, a large majority of clinicians report that all the excess documentation leads to the need to work from home, which then is independently associated with higher levels of burnout. And um, recent statistics show that 1 in 4 physicians plan to leave medicine earlier than they anticipated because of how burnt out they are. Um, there was actually a study that was just published last month in like the Kaiser Permanente journal where they surveyed like 1,000 physicians who had left the workforce early, basically, and asked them kind of about why they left and got some details. Two-thirds of them were women. The average age was about 45, and the large majority of them cited the stress and the hassle of medicine as a reason that they left the field. And so, if anybody in this room has had trouble finding a doctor or has to drive far to get to a doctor or can't get the care they need in a timely fashion, I mean, this is directly contributing to that. So, the electronic health record, when it was kind of rolled out, was supposed to help with a lot of these things and make it easier to access data. And really, all it's done is add more work and more clicks and more time and more paperwork and more administrative things that take us away from what we need to do. Um, so, like, I think that's obviously a pretty telling background. That doesn't even touch on um, sort of the actual activities that we as physicians do for our patients, diagnosing, treating, you know, um, the medical literature, if you could quantify it, which I don't know that there's a way to quantify it, but if you could, has probably gone up exponentially in just a matter of 50 years. So there was probably a day where um, finding medical literature for us on a particular topic. So I'm taking care of a patient with cirrhosis and I want to find the scientific evidence on a particular issue. Finding that and finding high quality evidence now is just much harder because we're in an information overload, right, stage where the number of articles that get published on a daily basis and the ability to keep up with that is essentially impossible if you take into consideration all the things I just talked about and all the ways we're spending our time. And so, how do we organize that information? How do we access it easily? How do we get it at the time when we need it for our patients, as opposed to having to spend a week finding the data and researching it when I've already seen my patient a week ago, and that asynchrony doesn't help, right? Um, that leads to diagnostic errors. I'm fortunate enough to live in a system where I'm surrounded by people who are it's academic. So there's good and there's bad, but the good part is that we're constantly teaching trainees and residents and fellows, and by having to teach, we have to keep up with new medical literature. So we're kind of that's built into our job. But the large majority of medicine is practiced outside of academic centers, and that's really where healthcare is delivered. And so in the community, in small practices where like doctors just don't have time to keep up with this stuff, it's not built into their job. And again, if they're spending twice as much time on documentation as they are on patient care, who's going to have the time to keep up with the medical literature? So all of a sudden you have someone who's been in practice for 15 years, and which means they're by no means close to retiring. They may be 50, and yet all the medical things that they learned in med school are now out of date. And so what does that mean for you all, right? Like, how do you get the right care? So I could go on and on, but I think the problem is clear. So I think AI, that's where that comes in, right? So how does it help us? So I'd love to pause here and ask if anybody's willing, or just again in the chat, like how many of you are aware, even just basically aware that one of your healthcare providers might be using AI, or even more specifically, like what have you seen, used? And like I'd love to know how people feel about this just off the bat. Um, so yeah, open the floor here at this point.
Frank said, I am aware, I'm fine with it in chat.
Right.
Did we have anyone else? I know somebody has something to say.
Do you get a lot of people, a lot of patients that say, well, AI told me this after you tell them something?
Yes, that's happening more and more. And I was gonna sort of touch on that in the patient side of things, on like who's using AI from a patient side and how, but we can definitely talk about that now. When people are putting their test results, their imaging results, their symptoms into ChatGPT or Claude or whichever one they use, and coming to us with um, sort of a sense of like what they think might be going on, and I don't know how many people here have done that. Show of hands. Just press the hand raise button if you want.
Please don't. That's everyone.
That's okay. Like, look,
I'll read the AI answer, but I like to scroll down and go to a website like
yeah,
the Mayo Clinic or somewhere and get my answer, or it depends on what
right.
I'm looking at, but I like to see what else is out there besides just what AI answers to whatever it is I'm doing,
Yeah.
whatever I
Go
look
ahead,
up.
Frank. Thanks, Nancy. Go ahead, Frank. You got your hand up?
Yeah, I was made aware. My brother is a gastroenterologist at Ochsner, in Meridian, Mississippi, and he made me aware that his notes were being taken and what have you. He described that he was having conversations in clinic, and when would get back, to his desk, that the notes would be written. And I asked my team, and they said the same thing, that it's just a tool to sort out, to save time for them to sort out the medical issues versus just some comments or questions I may have.
Hmm.
And then they turn around and welcomed the fact that I do ask questions, and they welcome the fact that I do that, knowing full well that I cannot practice on myself, but they like for me to engage in conversation with them.
Hmm. Hmm.
Frank. Would anyone else like to speak? Go ahead, Joe.
Apologies, I joined a little bit late, but so I created my own AI agent, and I use it kind of for like screening different products and different supplements. I uploaded my own data in there, and I use it to screen like whether that's, a lot of products are saying, oh, that helps your liver, but a lot of those products are actually designed for people who don't actually have like cirrhosis or liver damage already. So I kind of use it to screen those products to actually what was actually beneficial for somebody who already has liver damage. So it kind of gives me a score of how beneficial and how damaging it actually might be. So I kind of created that for that, and I do also know that my doctor kind of uses AI, and his team use AI to kind of help with the notes that they take. So
Hmm.
that's my experience with that.
Cool. Thank you for sharing.
Thanks, Joe. Anyone else?
This is great. Um, and again, anyone else, feel free to just jump in or put your hand up. Oh, Nancy, did you unmute? Did you want to say
Yeah,
something?
yeah, I was gonna say something.
Go ahead.
I do find it handy that when I look up something, or I do use Copilot sometimes, that it keeps track of all my past stuff and my health history and the things I like to eat. And it it
Yeah.
sort of puts it all together. It's kind of neat. I have found it to be wrong though once. Found to be
About your
wrong. I was
health.
looking up a plant and it was wrong.
Mm. Well, there you go. Yeah. I'm, cu-
Yeah.
oh, go ahead, Frank.
Frank?
Yeah, I would like to comment on patient portals because it seems that in my efforts as an advocate, I talked to a lot of patients, and we just didn't have the capability to handle our portals when we were sick, with HE
Mm.
being the real culprit. But I found now that I'm post transplant 2 years, and I've come to my senses, thank goodness, and really now I understand the portal is so key. You guys just don't have time to answer the phone and spend the time to talk to us. I also like the fact in my portal that everything is documented. My questions and the answers are documented. I can go back and check them. So, um, how do you feel about phone calls? Can you comment on patients that don't or cannot use the portal? Because Joanne and I were having a conversation about ease of the portal and the necessity of the portal. So if you don't
Mhm.
mind, can you comment about that, please?
Yeah. So you're, just to make sure I understand the question, you're saying that a lot of physicians and healthcare practices use the portal as a way to communicate with their patients, but certainly when you're sick and you have things like hepatic encephalopathy, it makes it hard to use the portal. So for those people who can't really use the portal as well for one reason or another, like just picking up the phone and calling the patient, and like, how do I feel about that? Is that your question, Frank?
Yes.
Yeah.
Yes. Thank you.
I mean, I do that a lot. Uh, I've got plenty of patients who, for one reason or another, just don't feel comfortable enough logging into my chart or can't, and ask that, we talk to them on the phone. So, yeah, I'll pick up the phone and explain the results to them, but I know that that's not common. And I think largely that has to do with time. Um, I mean, on the healthcare provider's end, a lot of people I call don't answer my phone calls because you guys are getting a billion spam calls a day. And the sophisticated way that spam has evolved is like now the spam calls are from your area code and make it look like a real number. So basically, nobody's picking anything up these days. And that's really challenging because I don't have a number I can give patients. I'm just calling them from whatever clinic phone I'm sitting at, or maybe I'm in one office one day and there's a phone there and I'm just calling some patients about results between patients. So it could be any number. So that's challenging because then they're playing a lot of phone tag. And if I'm being honest on this call, like I might set aside 15 minutes in the middle of my day to call a few patients with results. And if I can't get them at that moment, like the rest of my day is jam packed. So then I'm not getting to it till tomorrow. And you can only spend so much time calling people over and over again. So that's a big challenge. Um, but like we know that there's disparities in technological access, patient portal use. In fact, this is something that me and one of my colleagues are looking into this week. We've been tapping into some large databases to see if we can see if there's differences in who's using the portal based on age, ethnicity, health insurance. And so Epic, which is our electronic health record, which is a majority of health centers around the country, has a um, has something called Cosmos, which is if you're a participating organization, your all the data in Epic gets like put in this central repository. It's all de-identified and like completely anonymous, but it's like 300 million patients worth of like sort of just anonymous data, and you can like quickly query it to ask questions. So we're using it to sort of ask like if you take all the patients in this Epic Cosmos data set, 300 million patients who've had a diagnosis of cirrhosis, like of people with cirrhosis, how do patient portal use, how does it change based on things like age, insurance, et cetera? And we found that with with increasing levels of age, with um, poorer insurances like Medicaid and things like that, um, minorities, Black, African American, Hispanic, American Indian, Alaska Natives, those are all people who have lower healthcare portal access, statistically significant. So anyway, I think there's a lot of issues with the portals as well. But we need to reclaim the time to be able to call our patients and bring the human side back to medicine, which of course brings us back to what AI is helping with, at least right now in many areas. I wanted to ask something about what was mentioned earlier. So I'd love to hear from you guys about this, but like for those of you who have ever plugged something into ChatGPT or something like ChatGPT in terms of like, here's my symptoms, here's my test results, like what could be my diagnosis, and you bring that to your doctor. Like hypothetically, if AI tells you one thing and your doctor tells you something else, like how as a patient do you then proceed? I'm very curious about this because you're essentially AI is giving you a second opinion at this point, right? Before we had AI, people would get second opinions if they want like to make sure that they feel comfortable. And I encourage second opinions all the time if a patient wants it. But I also caution people like you might get a different opinion from somebody else. So think about that in advance because if I tell you one thing and another doctor tells you another thing, now you're in a position to have to choose. And how do you make that choice? So this question's been there even with second opinions, but now with AI, I think the question is the same. So I'm very curious, like if anybody has any thoughts on that.
Do you trust it? And how do you feel if one of your patients says that AI said something different than what you said? Do you
Um,
argue with them or just send them on and say you believe what you want?
well, personally, AI or not, you're always going to have patients who either like want to do the things you suggest or I mean like I don't take the approach that like you have to do what I say. I mean that doesn't to me make any sense because I'm not the one who's making your decisions. I'm here to give you the information you need, and we're all adults here. Like you need to make your own decisions, but you need to be informed. And I fully understand
So
that
do
there
you
are.
take the time to explain little things to them though that like,
Oh yeah,
well, this is why you need to do this and explain it to them and this is
oh
you need
yeah,
to do
yeah,
this
yeah,
because of this and if you do this and
yeah.
okay.
But there's still people where no matter how much you explain, like they just preconceived notions are hard to break. Um, I mean, um, there's some very specific examples of things that um, many people have a hard time, I think, accepting. Like, if someone comes to me with swelling in their legs and I tell them to take a diuretic medication, like, I've never had anybody, sort of argue about that. I mean, nobody, if somebody comes to me needing a liver transplant and I tell them that part of needing a transplant is that we require certain vaccinations prior to transplant, like, that's created a lot more um, controversy
Oh,
that,
I bet.
yeah, right. So, but again, like I then explain, like, hey, look, this is why for 40 years, we've required vaccines before transplant because we're suppressing your immune system and you're at much higher risk of getting severe infections. And, you can break down the science as much as you can, but sometimes people need to make their own decisions, and like you can't force people. I think, a big part of what we do is helping people kind of along the process of change, but empowering them to sort of be the ones to sort of enact that change with our help. Um, so I don't know. That's my approach. But definitely, it doesn't upset me. It doesn't, I think like, again, if that upset me, then I'd be upset most of my days. So you just have to be there for your patients
Now,
and support them through what they're going through, I think.
if a
I
patient says, well, I saw this on the internet, maybe not contradictory, but are you interested in what they saw? One of my doctors said, stay off the internet. Are you interested in hearing what your patients say if they say, I saw this on the internet? Maybe
Um,
we should try this, or it might be changing anti-rejection medicines or something. And
It depends on what it is. I think there's a lot of patient experience of disease where you can learn a lot from the others around you and, Facebook groups and like support groups, right? So like patients will come to me and say, like a lot of patients who have this symptom, you know, are finding that like doing this helps. And I'm more than open to listening to those things. I think when it comes to, I mean, yeah, changing anti-rejection meds is an area. I mean, look, if you look at something on the internet and you want to share it with me, by all means. But like, I think that's an area where I would probably say like, look, but this is not something to sort of experiment or play around with. And um, I'd probably steer them towards like, hey, let's just like let's leave that alone on what's on the internet. So it sort of all depends
mm,
on the context.
okay.
Go ahead, Jen.
Um, so, this is hypothetical because I don't think it's happened to me. Well, it could have very possibly happened to me because I do look up stuff on AI, but I also look at the sources and always do all that. Now, if my doctor told me something, because I'll look up like, for example, but I didn't have it at the time. I Googled this back when did this, but alpha lipoic acid was mentioned to me as something that would be good for neuropathy. I looked it up and found out that it hadn't been proven for alcohol neuropathy, but had been proven for diabetes neuropathy. And so I asked my doctor and I said, is it okay if I take this? And he said yes. And he told me the milligrams I could take, but I listened to him. So if today it happened to me and he said something different to me than what I found with AI, which I think is a little bit smarter than Google, I would probably ask him, make sure I understood the why, and then I would go back. I would do whatever he says because he's my doctor and I'm going to do what he says. But then I take it back to AI and I challenge AI on it because
Hmm.
that needs to happen more often.
Yeah,
Is
that's a great
uh,
point. Um, I think these are all great points, and I think AI is going to continue to get better and better. A lot of patients who have come to me with an AI diagnosis, I will be honest, oftentimes it's like pretty much on point. I mean, the one thing it can do really well is it can really recognize patterns, and it can give you a list of things to think about, which might be more thorough than what your physician's going to be able to think about off the bat, right? We have biases as humans, and our biases are affected by our recency bias, right? Like what we've seen more recently, what's less common, what's more likely depending on your demographics. We know women are more prone to certain types of autoimmune liver diseases than men, and we know, you know, whatever, like depending on where you're from in the world, there are some diseases that are more prevalent in certain parts of the world. So that stuff comes into our minds. It's almost like quick thinking. And so we don't always think super broadly about everything. Whereas AI actually is pretty good at saying sort of like, well, here are the common things, but also don't forget these other less common things at some point. And I think that's actually quite helpful. So I find that when patients really come in with AI information, it's actually usually pretty good. It's much better than what people used to get just by doing their own Google searches. And someone earlier mentioned Mayo Clinic. Like Mayo Clinic itself is a great, well-reputed health system with great physicians, but the websites are all static. Like it requires constant updating to be able to give new information, and how that's just human power to continuously update websites. So even the Mayo Clinic's educational website, it's not wrong, but it's fairly limited. And now AI can synthesize across, everything, and it's going to be more up to date. It's going to be more, I think it's just going to be better for patient education. Um, so, Tony, you got your hand raised?
Yeah, hey, how you doing?
Hey, good. All
Thanks
right.
for joining. So,
Yeah.
I have spent the last I don't know how many hundreds of hours in the last few months embedded in AI, doing a bunch of things for
That's
professional
an
purposes.
understatement.
Yeah, that's an understatement, as anyone in my family or some of the people on this call know. So I'm really fascinated, and I'm very impressed, in particular, with Claude and the things that I've been able to do. And um, we had I do have a question, but one example, it's unrelated to human health, but Nicole had a very sick cat, and anyone who knows Nicole knows that she probably cares about her cats more than she cares about her mom and dad. But we got a I'll
Well,
say a diagnosis that we didn't agree with, right, from a vet, and we did a ton of work in Claude, and it actually led us down a very, very significant path of improvement. And we sought out the right care, and now the cat's doing great. The cat's on mycophenolate, which we all get a kick out of. But it helped us. It led to, and to your point, we ingested a lot of data, and it's great at taking data and looking at what it might mean from a, diagnostic perspective. So I, I guess the
Yeah.
question I have is, I'm just curious from, department level, are there initiatives that are being put together and funded and driven to help like organize around AI and the ability to, ideally deliver better outcomes faster, or is it all kind of left at the moment to be sort of ad hoc at the physician level? Individual doctors deciding that this might play a bigger role in their practice than some other doctors, or is there an attempt to like organize this in a way to say we might be able to learn more about our patients earlier in the process of disease and lead to a better outcome if we start aggregating this information, as you said, from Cosmos and literature, and actually like putting it together, synthesizing it. But that almost has to be done, I would think, at like a department mandate level, that this is important to the program rather than left to
Mm.
individual doctors. So anyway, just curious how that's taking
Yeah.
place at UNC and at other places that you're aware of.
Um, that's a great question. It's a little tricky. It's a little hard to answer because, I mean, see, AI has come onto the scene really fast, and it's too fast. It's coming on top of a healthcare system that, as you all know, is super fragmented. And so, everything you're saying, Tony, is obviously super spot on and would be a great idea. I think the challenge is, how do you take a fragmented healthcare system where essentially nobody has time to do anything, honestly, um, and somehow organize really quickly to take data that's currently fragmented. And I mean, like, even like, you all know this, but I have trouble accessing people's medical records when they get seen at Novant Hospital in Eastern North Carolina, like, couple, like 100 miles away. And I can't even access their records. And like, so how do we then go from a system that's like that and then all of a sudden take all this data and like rapidly synthesize it? I mean, it's not easy. And a lot of the data is garbage to begin with because it's
Yeah.
just what humans are putting in. And while AI is good at sorting through garbage, it still, creates a lot of issues. So
Yeah.
it's not really happening, honestly. I mean, what's happening is definitely on the individual sort of position level. There's mostly that, but there are the movements are, I mean, um, so like I'll get into this now. This is a good opportunity to sort of shift a little bit to like what are we using actually? And I think some people mentioned that their providers are using AI to write their notes. So like these are the things that are really, I think, happening on a larger scale right now. And honestly, I mean, I think that's the place to start. So this is called ambient listening. So you've got something that listens to your conversation and then takes that conversation and turns it into a note. So it cuts out the extra stuff like the chit chat and just focuses on the medical things and puts it into the chart as a note. So that would take me 5 minutes to type up if I was typing it up after I was seeing a patient. Now it happens essentially instantaneously without me having to think about it because it just listens to our conversation. So look, if you say 5 minutes per patient, like, I mean, that's great. If I see 15 patients in a day, I've now saved over an hour, right? Uh, that's one. That's the single most widely adopted AI tool in US healthcare at this point. Nearly 100% of like health systems that are doing anything with information technology and AI are using these tools. Um, uh, there's AI assisted patient messaging, right? Patients will send us messages, and I know I'm sure people are going to have thoughts or opinions on this, so definitely want to hear it. But patients will send us messages. UNC has a tool, and it's not just UNC, a lot of places do, where it'll read the message, it'll give us a drafted response to it, and then we are responsible for reading the draft and modifying, adding to it, and then we have to approve it to send it. Um, I actually find that that tool is actually not that useful because it's just really generic stuff. It doesn't have the depth of knowledge to be able to like tell me what to tell patients. So right now it's only good at like if a patient says like, "Hey doc, I'm taking the medication and things are going great," and it'll say like, "Great, glad to hear that." It's like really good at generic responses, but the things that exist in my head about my patient and the things I know about them and the relationship we have and the struggles that they've had and what they're going through, like none of that's in there. So it's not that good, but that's there. And they've studied this and they've actually shown that the responses that it generates are rated more highly by patients in terms of empathy, in terms of completeness, in terms of information. Um, However, and this is fascinating, in one study, when patients knew it was written by AI, it was rated more poorly. The same responses, if patients didn't know it was written by AI, was rated more highly than human responses. So uh, objectively, patients like the responses. It's once they know it's AI, they start not liking it. And and then Nicole, I know you've got your hand raised, but just one more thing, Tony, to your point, the one part that is happening a little bit more that maybe is what you're alluding to is like um, integrating AI into the point of care to help doctors get more information about the patient's disease. And this is really interesting. So if I'm using this tool, that ambient listening tool that's listening to my conversation with my patient in the moment, if I wanted to, I don't actually do this that often, but if I wanted to, I can have that screen open on my computer and we're just talking. And as it's listening to our conversation, it will start suggesting things that might be worth doing for this patient in terms of treatment. So, like, I have a patient I'm seeing for uh, primary biliary cholangitis, which is an autoimmune liver disease. And we're sitting there talking, and as we're talking, the AI will say, "I noticed this patient mentioned." I mean, it's not exactly this is not exactly how it does it, but it'll basically like it'll hear the patient mentions itching, which is a very common symptom of PBC and many other liver diseases, and it'll say, "Click here if you want the most up-to-date evidence on how to treat itching in liver disease." And so I can click that and it'll access the medical evidence base and give me information on how to treat itching in liver disease. So it's clinical decision support is what it's called at the point of care using the AI search tools that are medically vetted. Um, and, um, I think like there's a lot of places in this country where healthcare is delivered sort of poorly. Like I hate to say it, but like I think there's a lot of providers who just are not giving the best quality care. And I'm not perfect either. Well, none of us are perfect, but I think just like systematically, there are places where healthcare is poor. Like these kinds of things can potentially lift on average the quality of care that's being delivered. Anyway, Nicole, I'll pause here. You've got your hand raised for a little while.
Yeah, I just had a question about, or something I noticed, in my last appointment, I don't know. I don't know how it came up. I guess I was just talking to Wegerman. I was like, I'm really tired, da da da. And I was like, um, but I was saying basically how I don't think it's anything with, medically. I was just saying I'm tired. I think it's the hot weather and the cat's in my bed. It's just I'm trouble sleeping, da da da. And it took what I said and it used interpretation and it said that I'm feeling very claustrophobic.
Hmm.
And with my cats, none of which I alluded to. Um,
Hmm.
and then there was another in that same visit, the note populated with I said something about my birth control implant, and I said, I've had this replaced every 3 years. I never had a problem, and it generated I've had a problem every 3 years.
Hmm.
So
Hmm.
what I
Yeah.
guess like how if this were the kid now those are so minor that I'm like, yeah, it's kind of funny. Like, LOL, I'm claustrophobic, like kind of
Yeah.
funny because it's
Not a
not
big
true.
deal.
But like
Yeah.
in terms of that, if that were to end up on someone's note for
Yeah.
pre-transplant, and not those examples, but had it been a more severe example, and that ended up on someone's chart, and then come evaluation, it's
Hmm.
misinterpreted information.
Great point. And this is part of the risks that I think are worth talking about. We have to, as the humans in the loop, have to be constantly checking our work. And I think AI has, like philosophically speaking, what AI is really good at is generating language, but that's not intelligence. So, when you read about AI in general and you think about like artificial intelligence, it's actually a little bit of a misnomer. I mean, people use the word artificial general intelligence, AGI, which is all the things we do as humans in addition to just generating language. It's, interpreting, calculating, math, feeling, like all these things. AI right now is just generating words, but the sort of, not the hallucination, but the illusion that that creates is one of true intelligence, because language is how we communicate. So when someone can create language, you think, well, then everything else is there. And so I think like that's the risk, is that people who don't really sort of think about this will take AI's the information it gives as fact. And I think we need to be very careful there. So when I use these tools, I look through the note to make sure everything it wrote was correct. And um, there have been times, so like one thing it's not so good at is if I'm in the room with a patient and like they have another person in the room, like let's say it's their spouse, and if the spouse starts speaking, it can't really start to differentiate multiple voices. Not yet. I think it'll get there pretty soon. But so I've had some times where the spouse will mention something and it'll insert that as if the patient mentioned it. So like, that's happened. But there's a counter to this. So while that sounds worrisome, I will tell you that every single that notes for the past 10 years before AI are riddled with errors. I will tell you that those notes are riddled with more errors than what AI has right now. And I think that that's something that's really important for all of us to remember, is every time something new comes on the scene, we're so hypercritical about about its risks. And I think we should be. I don't think that that's a bad thing. But I think we have to remember like all the problems that existed beforehand. And um, there's this thing called copy forward in the medical field, where if I have a note from my last visit with a patient 6 months ago or whatever, let's say, and I'm seeing them today, I'm not going to rewrite the whole thing because a lot of things won't have changed. I'm going to pull that note forward and I'm just going to update the parts that have changed. But this copy forward ends up leaving a lot of historical BS in the note, which is oftentimes actually not true. And so there's these things that just get carried forward in people's charts for years and years. And then once something's been in there for 5 years, it's sort of like fact, when a lot of times I'll see a patient and I'll say like, oh, there's this diagnosis of atrial fibrillation in your chart, and they're like, I don't have atrial fibrillation. What are you talking about? And it's just been in some one person wrote it one day 5 years ago, and then it just got stuck forward. And so, like, these are all things that potentially can actually get improved if you've got a second thing listening and capturing it correctly, I think. So
So what,
definitely
so
interesting.
if, and let's say like this was again like something more complex, not, I'm not going to say mistake because it is interpreting and it was somewhat accurate, but if I were to bring that and say like, to Wegerman and say like, hey, this is not accurate or this is this or something, like how long do y'all have to kind of go back and edit those?
Oh, I mean, we can edit our notes whenever, even if it was
Okay.
generated by AI. There's no limit on that. We can
Okay.
edit at any point. And yeah, there's been times where patients have messaged me like, "Hey, by the way, this was written in my note. It's not true," and I'll go back and fix it. I mean, I think notes are now available to everybody, so we need to be careful about them. But that's not what a note was ever designed for. A note was for like, for a physician to just like kind of keep brief notes so that they can remember things. And now it's become these like super scrutinized, narratives that everybody's writing. But like it's not really designed for that. And but you make a really good point. Like, it shouldn't have inaccurate information because it now is available for everybody to see. And so, by all means, I think you could sort of reach out to her and just say like, "Hey, I think that that was incorrect." Uh,
I think she knows I'm not claustrophobic by my cats,
yeah,
but but okay, I was just wondering in case it was a pre-transplant evaluation
yeah,
scenario and
no,
that
for
was
sure.
something like that it interpreted differently. But okay, thank you.
I
Yeah, no problem.
the carry forward thing is interesting because we have to laugh every time Nicole gets admitted to the hospital, which she just recently had because she had a biliary stricture, and it's Nicole is admitted for, headline and
Uh,
17 other things. It's
yeah,
like,
yeah,
and it's like, oh, really? Like, all of
yeah,
everything you've ever had from when you were like 12 years old seems to show up on this
right,
list. And we have to laugh at it every time it comes in. So every time we see it, but,
totally. Yeah,
uh, no,
and yeah,
I mean, I really am excited about what you're talking about. I think particularly as we've experienced liver disease, I have a good friend of mine who's an orthopod, and I've talked to him about AI, and his opinion is orthopedics benefits from already extremely good diagnostics, right? X-rays and MRIs, and there's not as much room likely for improvement of outcome versus existing diagnostics. But I think from all the people that I know, that are on this call that have gone through this, there's the decision tree and the diagnosis has got so many branches that are a lot of, as you said, itching. And there's a lot of seemingly qualitative things that people will
yeah,
mention off the cuff that when you string them all together, it starts to paint a picture that might be different. And I think in fields like internal medicine and particularly like liver disease and others where it's very complex, having someday the dream of in the future having better diagnostics that are listening in real time and helping to drive better decisions is going to lead to better outcomes because there's just so much information that isn't able to be captured in a simple diagnostic like an MRI or an X-ray, which tells you almost all you need to know. Right, so I think it's
yeah,
really exciting, and I think it's early days, and you're right. I think we're all critical of it. I did some work at a company I'm on the board of, predicting a revenue forecast model for them as an example, and people were like, "You're, this is only plus or minus 20%." And I said, "Well, how inaccurate do you think it is when you ask the same question of the five people you otherwise have to ask?" And they
yeah,
come up with their own number. It's way worse. It's way better than what they come up with. So
totally.
people are cynical, but I think it's early days and it's exciting, and I'm looking forward to better outcomes for particular diseases like liver disease where it's not cut and dried, and I think it's going to change a lot in the next decade how people are treated, and I'm happy that you and others are really putting effort into it, and I just hope it gets adopted at a more of a department level, and decisions get made on hiring, and maybe a lot of departments will need AI analysts to work with subject matter experts like yourself to
Mhm.
actually sift through what's being sorted out, because you're right, you do need to know what you're looking at, but
Yeah,
somebody needs to really drive we can be better at this, and better outcomes lead to better treatments and better efficiencies of the services. And you might start seeing AI folks being added to departments now in the future, which will be interesting. So
And I want to mention something else, which is that there's a big worry, not just in healthcare, but all across the board of like what's going to happen to people's jobs when AI takes over. And I think it's just I like cackle when people in healthcare worry about this because we spent 20 years, complaining about all the stuff that we have to do, all the stuff I mentioned in the beginning of this hour, clicking and writing notes and all the hours we spend. And people will complain about that, run your mouth off complaining about that. And yet, when you have some tools that help us not have to do those things anymore, everyone's all worried that they're going to lose their jobs. So I think that's a bit ridiculous. But I know in a lot of other fields, like that's a question. I read something not too long ago which is like which had to do with like the employment effect of new technology. And the argument that was made is that, like in the past with things like steam engines and, all the other things that sort of changed revolutionized certain fields, when the cost of the work goes down, then the market for that goes up. So people, for example, in healthcare, like there's a lot of people who need healthcare. So if delivering healthcare and the stress of delivering healthcare and the cost of delivering healthcare goes down, it's not like people are going to lose their jobs. It's that we're going to have more opportunity to take care of more people, and there's going to be more of a need to hire more physicians and more nurses and everything to deliver that care. And so, cheaper inputs don't shrink industries. It just sort of increases productivity, and I think might increase employment. So, I think that's an interesting way of kind of looking into things. And I know we're coming up on the last few minutes here, so I want to make sure others have an opportunity to share or ask questions. I mean, we could probably spend hours on this, but what other
Okay.
thoughts?
I'll read a few comments. Boston Sean said he uses AI to ask questions before asking his doctor, but he always goes by what the doctor says. And Allison said she asked AI to cite sources, and if any of her trusted websites are listed, she'll read what each of them says. I trust my doctors, and I also know that they don't have time to keep up with all of the changing information. I have
Mhm.
informed my doctor of new things more than once.
Yeah,
I will say
that's
that
great.
when my cat was sick I mean, she's still sick forever, but like, initially Claude did give us like suggestions of questions to ask too, which I thought was helpful because sometimes even though I work in veterinary medicine, sometimes when we're emotionally in that whirlwind, we don't always think of the right questions. And so I found that useful too.
I'd
Hmm.
love that. I think I would highly encourage that. I think people need to come into their visit ready to get information, and if that's going to help them, that's great.
I really don't like that what you said earlier about how it gives the information, but what it doesn't take into the consideration the way the patient feels and that the empathy's not there and what they're going through and what personal stuff that contributes to their health and what not, and it doesn't take all that into consideration. It's just facts, just the facts.
Yeah, I mean, it's not that it doesn't
And
take into consideration, it just doesn't have that information. Like that
yeah,
exists in my head, right? When I about the patients I know, so it can't access that information. But
it
yeah.
does make an interesting conversation with AI. If you ask it, I did this. Are you telling me what I want to hear? Turned into a lengthy conversation of what
Mm,
parts of it I don't trust and why don't I trust it, and is there some reason that gave something that gave me reason not to trust it. It turned into quite a conversation there.
mm.
So it has been programmed to not disagree with someone, or it doesn't want to be disagreed with, wants to be right.
Yeah, that's a pretty commonly kind of discussed aspect of particularly ChatGPT, I think, and that's largely, like in some ways how they keep people using it. and it's very sycophantic. It wants you to like it so that you won't stop use it.
Yeah.
We are
Hmm.
we humans, we just like to be liked, you know?
I,
Um,
I instruct Claude to be my ruthless mentor, and that's in my instructions. And I keep saying whatever does do that. Like it will come to me and say, I don't think what you're saying is true is actually proven in this data. You should rethink, your thoughts. And it's actually kind of rude, but I like it. I've told it to be that way. I've told it to be my
that's a
ruthless
great
mentor.
idea. You can change the settings in a lot of these, even in
Yeah.
ChatGPT, to sort of be a little bit less agreeable. And
Yeah.
I would
Yeah,
encourage that across the board,
it's
honestly.
fascinating because you're right. Otherwise, I told Nicole I was doing some work, and at one point it's like, oh, and how's Liza? Like it's trying to be a human. In a
Oh,
totally
wow.
different chat, it was asking how Nicole's cat was, and I was talking about, revenue forecasting, which has nothing to do with cats. So, but I've since changed it to be, yeah, be very critical of my thinking because
Yeah,
I'm going to be critical of yours, and it's actually helped a lot, frankly. So,
yeah.
In one of our earlier meetings, our meetings, like the first hour, it'll say this meeting's being transcribed by AI. One of our earlier meetings, we were reading it, and maybe Jen, you might remember this, or Lindsay, but it was hilarious. It had exaggerated some things
I bet.
and sort of interpreted a lot of things in its own way, and it was really funny.
Yeah.
Do you
There's
ever
another.
use it? Do you ever use it and take credit for what it tells you to your patients and say, well, I learned this a long time ago, but you really just
Uh,
looked it up there?
I mean, I use it plenty of times to look up. So I didn't mention this, and maybe you guys know about this, or I don't know if you do, but there's a there's a website called Open Evidence. So that's the healthcare version of like a ChatGPT, but it's has access to like the entire library of like medical literature. And so, oh
Thank
yeah,
you for that.
full transparent. So yeah, I don't know that you have to have like a physician number to be able to access it.
Mm.
Um, but yeah, oh yeah, full transparency. I use it plenty of times. Yeah, just a couple of minutes, I know. I
I was saying
oh
they give you three free ones, I think, a
oh sorry,
day and
yeah.
evidence. So you can
Yeah, so
ask them.
you can then
I think
ask
it's
it. It's actually
yeah.
really good. I use it fairly often, but it's not about taking credit for it. I mean, I'm not like first of all, I mean, I don't know. If I didn't have AI and I looked something up in like on PubMed and looked at the article, I mean, am I taking credit for that or am I just telling you what the medical information is? You know, however I get the information, I mean, I mean, I don't necessarily know that I need to sort of disclose every single place I get information from as long as you know that I can trust it. I'm not
Well,
saying that like I generated the research, but uh or like, oh, I've
there
known
is
this for 15
someone
years.
here who I did learn something from. If you're using AI, don't tell anybody you're using AI. So,
Why is that?
because you want people to think you thought of it yourself, that you're that clever.
Well,
Frank
I
said
don't
that it gives him insight into how to approach a subject. Frank is got a lot of insight, and I can agree with that. That it
hmm
can be helpful for that.
hmm
I
Does
was
anyone else have any? Sorry, go ahead, Nicole.
Oh, I was gonna just make one more thought that I keep meaning to do this, but even though like even though I'm a year actually and 2 months exactly today from my transplant, like it's still I still sometimes obviously, I mean there's so many meds, but I was thinking that a good use for it could be like, hey, here's my list of meds. Which side effect am I hitting on, like which medication, instead of looking up each one individually
Oh
and
yeah,
just being like, all right, just generate like which side effect this matches with so I can, better bring that to, like, I don't know, like if I had to tell Wegerman like, hey, this is happening, like I just feel like I would have more like an educated questions or like
yeah.
thought process
It's
for
a great
that.
idea. Definitely, I think that's a great idea. I want to say one of the projects I've wanted to do, I just don't have the time necessarily to do it, is uh I think patient education is an area where this can actually help a lot. And clearly that's a lot of what we've been talking about. And I think what's currently available, like ChatGPT, is available for that. But um, I think a lot of patient education happens in the visit between the patient and the provider, in that sort of like holy sort of, like that patient provider conversation. And for the first time ever, we have ability to really access those conversations if people allow. And if you could take those, if you could take that, like 1,000 patient provider visits for patients with cirrhosis, and you take the conversations that are happening in those visits, and you use that to train a secure, it has to be private and data secure, but you train a large language model on patient provider conversations in addition to everything that already exists on the internet, let's say. I have a hypothesis that you could make a chatbot that's actually even that much better in delivering education, because not only is it going to sort of have access to what's existing in the internet, but it's going to have access to the nuanced ways that physicians explain their disease to their patients, right? I have analogies that I use for my patients, and I think some of them are unique to me, but like I described a liver and cirrhosis and all that, like a house, and I have all these things. But these are ways in which like we find, I think every physician has their own way of like kind of explaining things to patients. And if you sort of if you collect all those, I think it's an interesting kind of concept to ask like whether you could create a patient education tool based on that.
Well, I know myself that, hi, this is Kim from Oregon. Hi,
Okay.
everybody. I know myself, my doctors are very busy and I see them once every 6 months. And I put together a list of questions because I know that 30 minutes I have with them is very precious. And I go down the list and they always see me take out my phone at the last 10 minutes of the visit and they say, okay, give me all your questions. So I think anything that AI or like you're talking about, what you've got in your head to maybe put together, I think anything like that would be beneficial for us patients.
Yeah.
Well, we're done with the hour, so thank you,
Thanks,
Dr.
Lindsay.
Shroff.
Yeah, no, thank you
Ben, do
guys.
you
This
want
was
to
great.
say anything?
Sure. Yeah, thanks, Dr. Shroff. I know you're watching your daughter tonight, but you're welcome to stay with us for our 30 minutes and if people have further questions. But I do know I do know you're single parenting tonight, so absolutely no pressure on you. But this, I have to say, um I mean, extremely impactful. And your depth of knowledge on this subject is, I mean, I'm so happy that we brought you here today because I learned a lot. I mean, I thought doctors were busy before, and just hearing about everything in the pajama time. And I'm just like, and you're sitting here with us, not to mention you do work for, advocacy organizations and you're part of our whole health advisory council. You guys do a lot of stuff and I know all the articles and everything and the research that goes into the work that you guys do there. So I just want to thank you because and I hope we can make your job easier so that you can treat more of us and get us all better if we can. So thank you so much. And
Oh
yes,
yeah,
and
thank you.
yeah, good,
I
good.
do have to hop off. I'm sorry. I would have loved to stay for 30 minutes, but I do appreciate everybody participating and all the great questions and thoughts. And it's so much fun to be able to just interact with everybody here. So everyone have a good rest of your week.
You too. Have a
You
Thank
good
you so
too.
night.
much.
Thank you,
Bye
everybody.
bye.
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 Thanks.
All right, everyone. We're in reflections. So if anyone would like to talk or bring anything up, congrats, Nicole.
Yes.
Yeah,
No, on your two
I'm gonna drop
interview.
Nicole, but thanks for letting me join this. Everyone here, I had a good time, and yeah, I'll let you guys. I won't crash your party, but I'm
Okay.
sure I'll be.
We'll talk about
Hey,
you now.
You can
happy
talk
to
about
have
me
you.
now.
Okay.
So,
Thank
Thank
all
you,
you.
right,
Tony.
see y'all. Bye.
Bye.
Bye. You're
Well,
right. He is in love with Claude.
Yeah, he's had to do a lot of financial stuff for like me and just yeah, he's done a lot with it.
that was a
But
good
it did
question.
help a lot with Liza, so
That was a good question you asked.
Well, I mean, hey, like if it, oh, by the way, sorry, I was just talking to him like we knew because we know he knows my hepatologist, but that's my hepatologist who I wasn't like name dropping like someone. But just because they know each other really well. Well, I was just curious, like again, my like mistake that I found was so minimal, but like what if during evaluation they found something that wasn't minimal and then
Yeah.
um
That carried over, like unwilling. Yeah.
I
Yeah,
mean,
like
he already denied me, so
You didn't need anything carried over. You were done.
I just wouldn't have needed something else.
I was
Um,
waiting on you to ask him something about does AI tell you to deny people?
I
when
was
is
thinking
AI
that
going to be
too,
responsible
Nancy.
for transplant evaluation? I
well, yeah, I mean, it is it does make me curious though, like, how they I think if they were to use it in a way that would pull information, like he said there's this Cosmos, right? Like,
Yeah.
I mean, come on, I'm not the only 31-year-old who was going through this. Like, I know it could have been like a useful tool in the sense of like, pulling more information about others in a similar age demographic and, would that have been like, oh, look at, what similar kind of circumstances surrounding it and see like, I'm not saying like because every person's success you know, is determined by them, but um anyway.
I had more of a question like your dad. Who is the person? Is there going to be a third person, or is there going to be someone that makes sure there is no wrong language, or that to like, how are we going to hold AI accountable, I guess, if that's a
Yeah, I mean, they use it in the vet world now. And so I haven't personally, but I've been kind of like a little bit of like a how to. And like so it'll populate sort of what was recorded into the like the SOAP, which is, the subjective, objective, like um all that assessment and plan, but we then have to go and just reread and make sure that everything,
okay.
that it heard the right things or that it populated the right things. One thing I will say that it's very helpful for is like, because when taking notes about like each pet that comes in is very tedious. You're eating, drinking normal, like, any vomiting, diarrhea, like all the things we have to ask, like that does save time to have it just rattle that off, like, and just have that repopulate and say, like, eating normal, drinking normal, like, so.
Go ahead, Andrea.
Hey everybody, I'm new to the group. Some of y'all don't know me. I'm a caregiver to my husband. I was listening to everything about the AI, the doctors using it, y'all using it, and the information that it gives, records, etc. Now, with you asking questions about your disease, medications, things of that nature, do you, what percentage would y'all say you trust it, the information AI is giving you? To where, hey, you're going to go cross reference somewhere else with something else. I understand going and discussing things with your doctor, but I am not a fan of AI just for whatever reasons, but I understand the importance of this community using it and the asset of it. But at the end of the day, again, how how good is this information? And if y'all do question it, where do you cross reference the answers that it's giving you so I can do this research for my husband?
what I do is, what do you use
I'm not
primarily?
using anything. We're brand new into this. We're only like 2 weeks into this, and I'm jumping in head first to do everything I can to learn this to help him.
Okay. Well, I use Chat GPT, but the thing that if when I ask questions, it comes up, I say, give me sources of this information that you're providing me. And so AI is only as good as you are at asking the questions because it will spit out what you ask. And then that's how you'll be like, oh, I should have asked it more specifically. So get as specific as you can with your question and ask for sources. And then I'll let other people share their thoughts.
There are some reliable websites, and it will take information from those websites and tell you where it got its information.
So it'll like kind of just like footnote it, pulled it from
Yeah, on the bottom, sometimes
xyz.com.
of like a paragraph, there'll be a little tiny thing that you can click on, like a little oval, and it'll have part of a word or something, and you click on it, and it'll go to the website that it got that from sometimes.
Okay. And I just saw somebody
Andrea,
put nh.gov.
Allison said she cross references with NIH.gov,
Mhm.
liverfoundation.org, AASLD.org,
Oh, okay.
and mayoclinic.org.
Thank you.
Frank, do you have some input? Go ahead.
There I am. Yeah, to just give some of you a little bit more background of my background, I took quite a bit of philosophy and logic when I was at the university, and logic is the basis of mathematics. So it's kind of like if you remember decision trees, um, but thens, terms like that. And when people ask me about AI, I express to them that AI is a tool that simply does searches, and it can access the information that we used to take forever. Just like in the library, we no longer, go to libraries. We no longer use the Dewey Decimal System. Some of you probably don't even know what that is. Um, we Google, and some people use Google, and then there are all kinds of other search engines. So these AI tools is how I reference them. Uh, I cross reference with AI tools, and then I always suggest asking the question. We call them scientifically. I'm also an analytical statistician, so in the social sciences. So we call it a query. You call it a question. So
Yep.
when you pose your query, be very thoughtful about posing it, and then pose it to several AI tools. And like Jen says, then you can ask for the references, and they're all recorded. But I use it to compare and contrast a vehicle I'm looking at. A 2020 Honda to a 2021 Forerunner, and ask for a comparison and contrast. That's the likenesses and the things that are not alike. So, and the other thing I'd like to say is it lacks emotion. It really lacks emotion, and I think that's healthy. Now, from the clinical standpoint, maybe not so. But from the research standpoint, it doesn't matter, if I think a Honda is a better car. That's why I'm asking it. I'm asking it literally for the statistical data of trying to come up with an answer to my question, but pose the question in more than one way. And then I think Angela, I mean, uh, gosh, your name fails me, Andrea. I think you'll hear the mantra. You're new to this, and you'll hear the mantra over and over. Ask your doctor. You can ask other people. A doctor is going to basically tell you to stay out of Facebook groups and not ask medical questions. But we're social creatures. We're humans, and if I'm itching, I want to know why. So I'm gonna ask you if you're itching, and then the real question is, what can I do to not itch? And everybody says, well, soak in this and soak in that, and then somebody will eventually say hydroxyzine. And my gosh, then you can mention it to your doctor, but your doctor may just have not figured out that, hell, you're itching that bad. I need some meds, doc. Rub cream on it. I've rubbed cream on it. So there's a balance. Everything we do is a balance. Everything, you're going to hear the same information over and over. You're going to hear it from different sources. And when you start hearing it multiple times, it's probably the truth. There's an old saying that if the third person tells you that you have a tail dragging behind you, you might want to look in the mirror, you know? So be conscious of on Facebook, who do you know and who do you know cares? That's why I invited you here, is because we care. I wouldn't be affiliated with these groups if I didn't personally recognize that they care. They care about me. We care about you. That's why we're here.
Thank you.
Also, just false information tends to spread faster than accurate,
Wow.
especially on social media. So,
Yes, that's factual across the board with anything. Yes, definitely, definitely. It's
I've
scary.
seen some crazy stuff on Facebook
And that's why,
and liver disease groups.
and that's what my concern was, and that was my concern because I mean, with the AI, you don't know what people are feeding into it. That's why I was curious about how y'all might cross-reference this information. So thank you for this. I appreciate it.
Now,
Andrea,
Andrea,
do you have any other? Go ahead, Frank.
one of the things
Or
that
Mr. Community.
worked well for me was I took all the notes and my blood work and everything, and I put it in AI. And I asked AI to give me the questions that I should ask my doctor based on these results,
Okay.
based on if I had an itch on my back. That way, my doctor can touch it, see what it feels like. Now I have the empathy, but I also have the questions that I should ask because those are pretty much are the questions that I would have anyway. And now I have them right there in front of me. I can ask and get the answer. So it helps with that anxiety a lot.
Okay. I'll have
thank
to
you.
learn to become a little bit more tech savvy too to do all this.
That's what we did with my cat's labs is we just uploaded them and then it
Ah.
it takes those numbers and it kind of generates like, it's not thought, but it's like um I guess just facts about it. And then that was when then it asked more questions and we get more specific and more specific, and that's when it said make sure to ask your doctor this and this and this. So it just is the easier way for it to, or for us to look at our trends rather than looking at having like every lab work pulled up and like on in front of us and being like, well, that number was this and now it's this. Instead it just goes and it then spits out like what it is, looking at those trends of those numbers.
Okay. Oh,
And Andrea, I also wanted to mention that be careful that when you get onto AI, like I pay $20 a month for my Chat GPT so that it's my personal Chat GPT. And so you don't want to be like in the general areas, but I don't know. I'd like to hear how other people use that, and do other people pay a certain amount and to keep privacy
I
for
use
privacy reasons?
Copilot and it keeps up with everything. Copilot's very personalized for
So is
me.
Claude.
what's the okay? So there's Copilot, Claude, and ChatGPT. What's
Gemini.
really the difference between the three? Or is
You
it
can
just
get
a
a free or
personal
paid version
preference?
of ChatGPT. You can get a free version or a paid, and you can use the free version, but then you run out of um like turns. Like if you get it to make a picture for you, it'll only make 2 or 3 pictures, and then it says you're all out of free pictures for 12 hours.
And
Try
also
again tomorrow.
also
Copilot's free.
Why don't
Claude
we
will
why don't
Claude
we ask one of the AI tools what's the difference in the AI tools?
Ah, that's a great
Claude
question.
will remember and keep conversations. ChatGPT will not be able to pull from previous conversations. So if you ask ChatGPT something, then in the I don't know about the paid. I'm not paying, but like, then you come back and you say it doesn't know how to reference a previous conversation. Like, you know, with my dad working with Claude with my cat, it would be able to like pick back up on things. And that's why it even brought her up, my cat up, and he was, you know, talking to him about like whatever he said, something fine. I don't know what my dad said, but
I
yeah.
have I have an answer here if y'all want to hear it.
Go for it.
It says the talk to and AI tools most people start with are either used to write code, generate images, analyze data, automate workflows, or build AI systems. So here's a practical comparison of the major categories. So I just simply, my query was compare and contrast the different AI tools. Okay, that's the query. Chat GTP is for brainstorming and research. Claude is for long documents and nuanced writing. Gemini is for Google ecosystem integration. Microsoft Copilot is office productivity. Perplexity AI is for research and citations. And then it gives strengths and weaknesses. Chat GPT is balanced all-purpose assistant. Claude is strongest for long form reading and writing. Gemini is the strongest inside of the Google Workspace. Copilot is strongest for Microsoft Office. Perplexity is strongest for search style research. So it sounds like maybe Perplexity and Chat GPT are strong, or well, listed here, it says it directly. It's the strongest two research tools that were listed of the five here.
ChatGPT does remember your stuff now.
Mhm.
They've updated it. It remembers everything I talk about. It knows I had a liver transplant. It knows it'll bring up that stuff when I ask about medications, and
Mine does
so
too.
Well, it
it's got a
remembers
lot better.
you, but like if I were, but I don't think it can pull up like when I talked to it about this lab work back in like, you know, 4 months ago or something. I don't know if it has.
Mine does.
Yes, it does.
And
It
my
can.
Copilot also does. My Copilot, I don't use it for Microsoft Office help. It remembers things like, well, because you had a liver transplant and your immune system is weakened and you had a calf injury several months ago that you need to be doing this and like it remembers. So I talk to ask it all kinds of stuff.
And I think it may have kind of like like a cache,
Yeah.
CACHE, a cache. I think that it can remember so much, and then you have to start paying, just like you can ask so many questions, and then for you to continue creating queries, it asks you. So yeah, but I found that I can talk about vehicles and it will remember the vehicles I spoke of earlier. It'll say, do you want me to add these other vehicles to the query you're doing now, in fact?
All right, well, I'm just flustered, so I don't know what I'm talking.
I'm gonna download Perplexity and try it for a couple days and see how I like it.
I would love to hear feedback from y'all that have tried certain ones that might be trying new ones too. That would be great.
Meta AI was not mentioned here. Meta is the platform for Facebook and Messenger. So that's one that I use quite a bit, and I generally run the same query on Chat GPT, Meta AI, and Google AI. And surprisingly, they vary, not extremely, but I see the benefit of asking the same query to three different people. I guess it would be
Yeah.
folks, wouldn't it be kind of like asking a transplant or three different transplant hepatologists the same question?
Yeah, kind of.
They're all. I mean, the disease is so the organ is so complex, and the disease is so complex that you're constantly getting different information. With slight variations, but it varies.
Thanks, Frank. Andrea, we have 5 minutes left, but I wanted, since you're newer, do you have any other questions for any of us? Since we have some transplant patients in here too.
We
So
met
many, but I
Andrea
could.
last night.
Oh,
Um,
okay, good. Okay, I just want to make sure.
some
Yeah,
of us did, not everyone, but a
Okay.
few of us did last
and
night.
I just want to thank the new people in this group. Thank you for letting me in and participate. I really appreciate that.
You are
Oh,
so very
I'm
welcome. And
glad
maybe
you
your
thought that.
husband will decide to at some point on
He
this
he's
meeting.
he's listening. He's not feeling well. He doesn't want to be on tonight, but he's sitting right next
Fine.
to me. He's hearing everything.
That's understandable. Well, I just downloaded Perplexity and it already knows stuff about me.
Oh,
Frank.
It gave me it the first suggestion it gave me when I hit get started was how much are road bikes under $2,000. So it already knows me a little bit.
Yeah, and
Wow.
that's
'Cause there
part of
ain't no
that.
way I'm paying that kind of money.
That's part of that data collection. Again, that was my field when I was working, and we have 73 million data points collected on you by the time you're 13 years old now.
What?
Yeah, and if you have Facebook on your phone, it is recording every conversation, and it's running algorithms in those conversations, trying to figure out what it will try to sell you next.
Oh, I get
So,
ads for every conversation I have. It's terrible. It's scary, creepy.
oh yeah, and it's not only the public sector has been gathering that data, and the private sector too for years. Those of us that are older used to hear about, oh, if you watch enough television, it's going to influence you. Well, absolutely it does. It's been doing it ever since the advent of television. So it's just part of our normal life, and that's how we get suggestive selling to us constantly.
Yeah, thanks, Frank. Well, if anybody else doesn't have any other questions, I'm gonna close the meeting. It was really nice to see everyone, and hopefully you had some questions answered. But thank you everyone for asking questions, interacting, all of it. We've got zero proof tomorrow at 2 if any of you would like to join. So
Next
I'll
week,
Great.
one day at a pa.
Oh, and next week, next Wednesday at 2, we have One Day at a Paw, our pet companion group with Nicole. So those are the next meetings. But
Oh,
otherwise,
we need to get that on the calendar because I
It
wasn't aware of
is.
that, and me and my buddy Max may need to show up for that.
It's on the Liver Circles calendar. It
I
should be
didn't see
now.
it.
If it wasn't, I'll see about getting it put on there.
Okay, I didn't see it. I'm sorry. Thank you.
Okay. I don't know if it's on. It might not be on there yet.
well, hopefully you and Max can go.
Max will be in charge. Thank you.
All right, everyone, have a good night.
Thank
You
you.
Well,
too.
Bye,
bye.
guys.
bye everybody.